Welcome to On the Beat, everyone. I'm over here with nurse Shellie Moffett from Monroe Regional Hospital, and we're talking all about the swing bed program. It's very interesting. How are you, my friend?
I'm doing good.
Alrighty, so let's get into it. What services does Monroe Regional Hospital do or provide?
We are a critical access hospital. We provide.
What does that mean?
It is a different kind of hospital payment base. We're able to keep patients a little longer on our swing bed program. It's not just quite like some of the other hospitals in the area.
Okay, so, well, now you just mentioned swing bed. What does swing bed actually mean, and what's the process within Monroe?
Our swing bed program is pretty unique to the area. Some of the other places have swing bed, but they're limited to how many days a patient can stay. A patient sometimes will need some extra days. It is a Medicare-based program to where we can continue their rehab or their treatment over a period of time.
So what's the average time that one would be in a swing bed?
You have to have 3 midnight stays in acute care.
Right.
So we have our 3 midnight stays, and we can transition you at that time, whether it's in our facility or from other facilities, and continue their treatment, whether it's rehab to get them up and going again, or to continue their IV antibiotics because they've had an infection or pneumonia, things of that nature.
Okay, well, we actually had some viewers write in and ask us some questions to ask you. So you ready for that?
I'm ready.
Alrighty, so one of our viewers wrote in and said, what does the multidisciplinary team consist of, and what is that? Tell me that. That
is a name of, we've put together a team. It is Monroe Regional's team. We have nursing, of course, providers. It's myself. I've been there the longest. I've been there since 2014. We have a physician and other nurse practitioners as well. But we have physical therapy to be able to get patients up and going again, PT, occupational therapy, and speech therapy for you people that are having trouble swallowing. We have respiratory therapy. Yes. We have, of course, our lab and our radiology. Okay. And just, we feel like, even our housekeeping. It is so nice for just people to come in and talk with the patients sometimes. It gets kind of lonely when you've been there for a while.
I can imagine. I've been in hospital for a long extended period of time. Right. Couldn't wait to get out. Not because of the care, it's just that I was so bored and lonely.
That's right. We can keep people for up to 100 days.
Wow.
Now, it is Medicare-based. If you have a secondary insurance, your first 20 days, Medicare tends to pick that up. Okay. And then after that, it's a little bit different. Right. But it is a very good program for especially our elderly folks.
Okay. That's what's needed for them. What are payer sources?
Our payer sources is mainly Medicare and Medicaid. We also have some commercial insurances that will pay as well. It just depends on what health plan you have. All
right, just remind everyone at home, just again about the swing bed. What's the process to be admitted to the swing bed program?
We have a case manager, and what you will do is call the hospital, 369-2455, and ask for the case manager who handles swing bed. She takes in the referrals, meaning we have to make sure their insurance pays for it and they've had their 3 acute care days. Okay. The physician and myself both look at it and see if we will be able to help that patient. All right, well, Shellie, thank you for coming in. We don't want to keep you too much longer. I'm sure you've got to rush back to the hospital. Yes. We appreciate you. If you want to find out more information about the swing bed program, it's fascinating. There it all is up on the screen for you. Monroe Regional Hospital. Give them a call, everyone. As we said, no one is offering this program here in the area. Back after this short break.